Welcome to the Journey of EFIC. This is the story on how the International Association for the Study of Pain branched out in the key European Federation of IASP chapters, a strong, more unified entity in the European community. Founder and first president Professor Ulf Lindblom from Sweden. Professor Manfred Zimmermann from Germany succeeded him. Professor David Niff from Israel, the key president from 1999 to 2002. President Professor Harold Breivik stepped in till 2005. From 2005 till 2008, Professor Serdar Erdin was in term. Succeeding him was President Justino Varassi, who was also on the board when EFIC was founded. The next president was Professor Hans Kress. EFIC is a multidisciplinary professional organization in the field of pain science and medicine made up of the 35 European chapters of the International Association for the Study of Pain, also known as the IASP. Established in 1993, EFIC's 35 continent chapters represent close to 20,000 healthcare professionals across Europe who studied pain and treat patients in pain, and to serve as an authoritative, scientifically based resource concerning policy issue related to pain and its management. Though the mission of EFIC follows those of the IASP, the specific aim of EFIC is to create a forum for European collaboration on pain issue and to encourage communication at a European level between IASP chapters and also with other bodies interested and involved in the fields of pain research and therapy. The formation of EFIC.
EFIC was founded by a very illuminated scientist, Swedish scientist that is Ulf Lindblom, and he was really clear in his view of what should pain in Europe be.
I was the founder of the Scandinavian chapter to begin with, and then I became the president of IASP. It was easy to realize that when I stepped down as president of IASP, I might suggest a European Federation of IASP chapters to put in a mechanism or a body for communication between the JASP headquarters in United States and the local IASP chapters in Europe.
There has been an international mother society that was founded in the United States 30 years ago in 1973. And this mother society, this first international society, had many local national societies, but the guiding structure was in the United States, and that was far away from Europe, and often the strategies that developed in America were good for American countries in their health systems, but were perhaps not as good as they could have been for European and Asian and other countries away from the United States. Therefore, we strongly felt here in Europe that we should have a European federation covering all the existing pain societies in Europe in order to give them better advice, which would be better tailored for the needs of European countries, for European health systems and for European patients.
Since its foundation in 1993, the European Federation of IASP chapters, EFIC, has rapidly grown and has become the voice of pain medicine in Europe today. Through our, meanwhile, 35 national member pain societies, EFIC represents more than 20,000 physicians, basic researchers, nurses, psychologists, physiotherapists and other healthcare professionals throughout Europe. What all these members have in common is their interest in pain or their active involvement in pain management and pain research. The new logo of EFIC embodies our corporate strengths and also our new profile.
EFIC is the Federation of International Association for the Study of Pain chapters in Europe.
Since 1995, congresses have been held in some of Europe's most famous cities. Pain in Europe 1 was in Verona, Italy. In 1997, Barcelona, Spain was the setting. In the year 2000, Pain in Europe 3 was held in Nice, France. And the 4th European Pain Congress was held in Prague in the Czech Republic in 2003. The next congresses were Istanbul, Turkey in 2006, Lisbon in Portugal in 2009. In September 2011, the Congress takes place in Hamburg, Germany, and Florence, Italy will be the setting of the next Congress in 2013.
I think that the Europe Against Pain initiative is an initiative which is among the most important things that the European Federation of ISP chapters has done, and it is ongoing and still very important. The initiative practically is based on two foundations: education and public awareness. Now, from the point of view of education, it was extremely important to introduce pain studies in medical schools. Even though some people die because of pain, there are many more that die in pain, and even many more live in pain.
The mission of EFIC is working on better pain relief and fighting for our chronic pain patients. EFIC promotes the concept and the idea of a European alliance against pain, for example, by our educational activities. Educational activities like the two European pain schools, the pain school in Montescano, Italy, and the pain school in Klagenfurt, Austria. But also by our high-ranking scientific journal, the European Journal of Pain, and last but not least, by our very successful biannual Pain in Europe Congress.
Today, EFIC is a very strong political power in Europe. So we are launching to the European governments more easily, and now everyone in Europe accepts EFIC as the main organization related on the pain field.
EFIC has realized that we should increase awareness of the societal impact of chronic pain, not only among healthcare professionals, but also in the media and in the public. EFIC was very successful in organizing two societal impact of pain symposia in Brussels, and the last one in May 2011 was not organized anywhere in Brussels. It was hosted by the European Parliament, and all our national councillors, as well as many members of the European Parliament, including the EU Commissioner Mr. Dalli, were present. This second Societal Impact of Pain Symposium in the European Parliament was a big step forward towards an acceptance, towards a public recognition of chronic pain as a true challenge not only to our patients and their physicians, but also a challenge to our healthcare systems in Europe, to the budget holders, to the decision makers, and also to our politicians. EFIC continues to work on the recognition of chronic pain as such a societal challenge in the future, and EFIC has therefore published the so-called Roadmap for Action, and this Roadmap for Action will help us at a national level as well as an European level to improve the situation of our chronic pain patients, to improve pain research, and to reach our goals and to fulfill our mission.
Research and education.
Finally, the so-called EFIC Grünenthal grant is especially dedicated to young pain clinicians, and with 200,000 euro every 2 years, their clinical research projects are supported. The EFIC Grünenthal grant, the EGG, is also an excellent example of a fruitful and successful collaboration and commitment between the pharmaceutical industries and EFIC in our fight against chronic pain and in our efforts to improve education and to improve research on pain. From the beginning, EFIC has undertaken much support and was very efficient in helping the developing pain societies from Eastern Europe, for example with our fellowships for young pain clinicians that allowed them to attend the European pain schools without any costs for them, or by our fellowship grants for working visits of young clinicians from Eastern European countries in pain management competence centers in Western Europe in order to increase their knowledge, in order to improve their skills and their experience in pain management.
European Journal of Pain.
It is the official journal of EFIC, and it has a rapidly increasing impact factor, rapidly increasing number of subscribers, and very many very good manuscripts are coming into the journal. Of course, now Herman Handwerker is the editor-in-chief, and he is continuing the very good work that first Ulf Lindblom as the founding editor, and then Fernando Severo as chief editor, and now Herman Handwerker are doing an excellent job to improve this very important journal.
Future growth of EFIC.
I would like to strengthen the communication between the societies which belong to EFIC.
We did not succeed until now to obtain around Europe the recognition, for example, of pain as a medical specialty. And this would be very, very important, because I think that pain must be recognized as a medical specialty. Otherwise, it will lose this opportunity to become something that is important. I think EFIC should fight for this goal, this final goal with the politicians.
I am very proud of these achievements, and I look forward to contributing, to supporting, and to playing an active role in the campaign for recognition chronic pain as a disease in its own right.